Welcome to With Honors. I'm Max Sandlin, and our question today comes from Micah Adama.
My question is, what are some interesting research projects that Harding faculty are involved with?
So when I heard this, I thought, I know one that is a little spicy, a little controversial, a little interesting, and that's what my friend Mendy McClelland is working on. Mendy, introduce yourself. Tell us what you do at Harding.
I'm Mendy McClelland. I'm an associate professor of biology, and I have been with the biology department for about a year and a half. So I'm actually trained clinically as a family medicine PA and previously taught PAs at Harding also. So currently I'm teaching anatomy and physiology to pre-nursing students.
So your background is in medical science and biology, and now you're teaching bio, but still working kind of on the medical side of that. Is that right?
So I'm actually taking a hiatus from clinical practice right now just to work in the biology program, but I had worked in family practice for about 13 years prior to coming back.
And your work in the biology department is with, you said, mostly nursing students?
Yes.
Still kind of medical connected?
Yes. So one of the things that I do in the AMP for Nurses course is actually bring some clinical applications to what we're talking about. So it still is fairly clinical, especially in the lab portion of the course. But I also have some pre-OT students and some athletic training students in my class.
Very cool. Very cool. I'm glad you're here today. Tell us about this research project that you're getting started with.
Sure. So I am actually researching contraception and predominantly hormonal contraception.
That means the pill, right?
The pill, yes. It's mostly the pill, though contraception is really a broad term and it could mean a lot of things.
Even, I guess, the pill is kind of a false moniker because there are multiple different pills and all that, right?
Yes, there are multiple different pills and there are multiple different types of hormones that could be in the pill, and some contain combinations of estrogen and progesterone. Of course, these are not real estrogen and progesterone. They're synthetic hormones that are in the pill. And some may just contain progesterone, but contraception more broadly is also understood to include things like intrauterine devices or barrier methods, things like that.
And so you're researching this because?
That's a great question. So I initially became interested in this topic when I was a PA student. So this was around 2010. I was in a bioethics class for the very first time, and I had never really questioned that the pill potentially could be an ethical issue for Christians.
Oh, I see.
So my first exposure was I was in a bioethics class, and the teacher proposed that the way the pill works in the body could potentially prevent a fertilized egg from implanting, which if you believe life begins at conception, then that could be a problem for Christians. And I didn't know that. I had never questioned that.
I guess really anybody who holds that position, whether they're Christian or not, right?
Right. Yes, it could be. There's actually a lot of other faiths that would uphold the value of life even at early stages. So I think it caused me to pause and say, maybe I need to look into this further. So that was where the question was planted in my mind, but it's slowly developed through various experiences I've had professionally and personally into something that's much more complex.
So to the complexity of it, like this research, I mean, is this a philosophical project where it's like I'm questioning the ethics of hormonal birth control, or is it a scientific one that's like, how does this particular medication interact with, pregnancy and so forth?
Sure. Right now, it's the intersection of pretty much everything you just suggested. So it's the ethics behind it. It's the physiological effects that are caused by the pill, particularly certain forms of hormones like synthetic progesterones. But it's also the theological implications and the philosophical implications. So the project that I'm working on right now involves researching some of the potential detrimental effects or things that could be harmful to the female body because of taking the pill. And there's some really interesting biological research that is ongoing right now. It's inconclusive, but there have been a lot of studies that have been produced suggesting that the pill, at least certain types of hormones, can suppress cortisol, which is a stress hormone.
I read about this a while back. It seems like Stacy Rodenbeck turned me on to this book.
Yes.
So cortisol is our stress hormone. When we get like attacked by a bear, we get a lot of cortisone. Is that right?
Yes. So cortisol is produced at certain levels all the time. You have to have it to survive. So you could even think of it as a hormone that is necessary for survival.
What does it do for us at baseline? Just like we're sitting here having a podcast, we've got some of this quote unquote stress hormone.
Sure. So it is going to produce the ability to run from a bear or the ability to perform any kind of stressful experience, including exercise. So exercise, although we don't often think of that as a stressful experience.
Speak for yourself. For me, it is a high stress experience, but
for some of us, it could be a high stress experience. But from a physiologic standpoint, exercise is a state of stress. You're breathing faster, your heart rate is speeding up. So what I typically tell my students is to think of this as what would happen if you were in danger. So cortisol is generally going to be responsible for any of those effects. So that's what allows you to run. It has a lot of really interesting things that it does as well related to mood. So without cortisol, you may be at greater risk of depression. And that's
mood swings too?
Mood swings potentially, but more of the issue with cortisol is that if it's suppressed, you may lack motivation to do certain activities.
Okay, because it helps kind of energize you yourself.
Yes.
Okay.
So also, if you're looking at the science behind what cortisol does, if you had to run away from a threat, one of the things that you would need is glucose and certain types of energy. So it allows your body to release some of those stores. So without any cortisol, you wouldn't be able to survive. But if cortisol is too low, then that could affect motivation and energy and possibly a lot of other things in the body.
And you're saying that this synthetic progesterone, some of the studies seem to indicate diminishes or suppresses cortisol?
There are some studies, though they're inconclusive, that suggest that cortisol could be suppressed with long-term use of the pill.
What's long-term? 3 months, 6 months, 5 years?
It could be a few months to a few years. Some people stay on oral contraception even up to a decade or more. So there's not really a good definition, I would say, of long-term, but any use that is not temporary. So when we, in the clinical world, differentiate something that is quick or acute from something that is more chronic, when we're talking about something that is acute, it means it's short-lived. So if you have an acute illness, you have strep throat, and it's over in a matter of days, and it's going to have a clear end. But when we're talking about long-term use of some type of medication or something that is chronic, like a disease that is ongoing, it may not have a clear trajectory, it may not have an end date. So if you're taking a medication long term, we don't necessarily know how long you're taking it, but it's just intended to be taken over a longer period of time.
It seems like a lot of things I'm hearing from friends in medicine, or things I hear in the news or read books, that there's a lot of research going on specifically about women's health right now, whether it's hormonal or autoimmune diseases, things like that. Do you feel like the work you're doing sort of is part of that wave of research in women's health?
It could be. I think that there has been a lot more information that has come out more recently about the potential effects of the pill, so that has piqued people's interest. But some of these questions have been around for a long time, and some of the issues with contraception have been around for a long time, and we just have not truly questioned why they were happening. So we've known for years contraception, at least hormonal contraception, has been around since the 1960s. So we've known that there's an increased risk of blood clots. We've known that In some cases, there's been some question about could it potentially increase the risk of certain cancers. At this point, that's even being questioned in the case of breast cancer, that we've always thought you took hormonal contraception that it could increase the risk of breast cancer. So
you think that that's being questioned, like that's not the case?
It's being
questioned
like... that it's not the case. Yes. It's being questioned that although we've thought for a long time that any use of hormones, including hormones that might be used for hormone replacement therapy in menopause, could increase the risk of breast cancer. Now that's being questioned in the medical literature. So I think perhaps to your question about is this part of the wave of research that we're seeing, that's certainly possible. I don't know that it is just because of that, but I think that it could be part of that piqued interest in this research.
So you were talking about there's also an ethical component of this for you. You do study bioethics as well as your clinical work, medical work, I know. How is your position different from, like, say, the Catholic position? I went to a Catholic school. We would talk about this kind of stuff there. Sounds like you're saying something a little different than their position. You want to talk about that some?
Sure. So it's interesting you mentioned that, because a lot of the initial resources I studied were from people in the Catholic Church, because they've done the most robust research on it. So the biggest difference between what the Catholic view is and what Protestants or evangelicals think is how do we view the purpose of sex? So what is it? What is the primary purpose of that? So how we would say that is procreative and unitive aspects of the sexual relationship in marriage.
And so in the Catholic position, I can talk about this a little bit, the Catholic position beginning, at least back to Augustine, but it really becomes sort of codified in Thomas Aquinas, medieval period. The telos, or the proper end of sex, the sex act, is procreation and love union. And if either one of those two is missing, then this is somehow a debased or deformed act, and therefore a sin. Venial sin, to use contraception, but venial means like not the worst kind of sin in Catholic theology. So there's a long tradition. I think most people, popular culture, know Catholics don't, or the Catholic Church does not approve of birth control of any sort. Except for what they call natural family planning, and that is abstinence during the period of ovulation so as to avoid pregnancy.
Yes.
And there's all sort of fun, like we could do a whole podcast about all the interesting debates and questions that I know I have about that position.
Right.
But you're saying your position is different than that. How's your position different than that?
So I don't think that the purpose of sex in a marriage is strictly procreative, and
has to be open
to procreation in every instance. I think the Bible is open to other interpretations or meanings of the sexual relationship in marriage. So I would not hold the view that contraception is always wrong. I think where most Protestants, are those that are in evangelical churches, would have a problem with contraception is if it interfered with the implantation of a fertilized egg. And what that means is that after sperm and egg have ceased, you have a zygote, which is a different kind of, biologically a different kind of being. And there is a clear trajectory at which it is moving towards development. We would call this embryonic stage at this point. And it is going to travel down the fallopian tube and actually implant into the uterus, and that's where it stays until birth. So if we believe that life begins at fertilization and contraception interferes with the process of implantation, many people in the Protestant world would say that that's causing abortion.
So when you say life begins, sometimes I find these terms kind of confusing. And I'm always a butter, so I'm always asking, but what about this and how do we do that? But life, I mean, like a sperm is alive.
Right.
An egg is alive. And a zygote is a lot. Like life is there all around, right? But you're saying something like personhood or a new individual begins. And you're right. Then this is a commonly held view among lots of evangelicals, right?
Yes,
and that's your default as well?
That is my default. I do believe that life begins at conception, but I have to give the caveat that if we're looking at this from a biological standpoint, it is a little bit more challenging to determine from a biological standpoint where the individual gametes, which are sperm and eggs, cease, and you have the formation of a zygote.
And pretty weird to think about like twins too. Like is
Yes.
that zygote one person or two or three or four?
Right.
So that's always I always find myself a little bit confused when people just say, well, this is very clear. And I'm like, I don't know. That seems kind of messy to me.
It can be a little messy. And I would also say that that is a common objection to life beginning at conception is twinning. So
Sure.
when is twinning no longer possible? Because like you said, if we're defining this in theological terms, well, did you start out with one soul and then have two? And that does get a little sticky. I think that some of the reasons that many Protestants think that life begins at conception is from the early church and how they were very protective of life, especially in that culture where...
Right, adopting exposed infants and that sort of thing.
Yes, and infanticide was also popular in the culture that the early church started.
Infanticide, just for some of our listeners, means in the Roman era, if you had a child, it was actually, abortions were very dangerous at that era. They did happen, but they were very dangerous. And they did have contraception in the form of like condoms, linen, or animal intestine, things like that. But generally, a woman got pregnant. If they didn't want the child, they would just what they would call expose it, and that is leave it out in the elements. And that's infanticide, the killing of infants. And Christians were known to go and collect these abandoned newborns and then raise them up.
Yes. And that still doesn't answer clearly the question of fertilization. And I would also say that if you're looking in the Bible for a clear answer, you're not going to find one definitively that says life begins at conception. But
seems like there's room for debate among
there's
Christians.
some
People
room
who love
for
the Lord
debate.
and
Yes.
love life still might have different opinions about is this at instantly at fertilization or later on. And that seems like part of the whole question is how do we think about that? But your research is not primarily about that ethical thing. You sort of have an ethical assumption.
Yes.
And tell me, what does the process look like for you? What's the next sort of steps in this? Because you're at the very beginning of this, right?
I'm at the very beginning of it, and I'm presenting at a conference for the first time on this research this summer. So I have developed a framework that I am using, but I also am trying to communicate that to other people who may not be sure if contraception is the appropriate decision for them. So I think that, first of all, you have to ask the question, what's the purpose of sex? What do you think about that? From there, are there any potential risk associated with hormonal contraception?
Medically, you mean?
Medically, clinically. And is there a potential risk of preventing implantation? And if so, would that be a problem for the person that's considering it theologically or ethically?
Do you do this research all on your own, or do you tend to work with a team?
I'm working with a team right now on a conference presentation. So it's myself, Brianne Ramsey, she's in the physical therapy department at Harding, and Daniel Crouch, who's in the College of Bible and Ministry.
And bioethics, yeah.
Yes, he does bioethics, and then Derek Estes, who is at Pepperdine University and is a philosopher and is very interested in fetal personhood. So we are doing this as a group this summer at the Christian Scholars Conference. And also within our department, we do have students that do their capstone projects on this.
I was going to ask how students could get involved.
Yes. So Claire Faulkner is one that comes to mind. She did her capstone research project on some of these issues surrounding the effects of contraception on female physiology. And we have others who are interested. So in the biology department, faculty will supervise a project and mentor someone to complete their capstone paper and presentation, and then they present that to their peers at the conclusion of the 3 semesters.
Well, I think this definitely qualifies as interesting research that Harding professors are doing, and I'm so grateful you came on with us today.
Yes, well, thank you for having me. I enjoyed it.
Thanks, Mendy, and we'll see you guys next time on With Honors.